Good morning. Thank you for coming today to see us and watch our workshop. We are very happy to have the first Institute School of Physiotherapy workshop here. So when we thought about this talk, it was such a challenge because we want to give you another perspective about the treatment with electrical stimulation for erectile function. So we don't have a lot of work about it, so we just want to give you a feeling of what is coming, what is next, the next steps of the research, and where we are moving with the treatment of the conservative treatment of erectile function. So that's my disclosure. So just to remember that erectile dysfunction is defined as the inability to obtain or maintain penile erection sufficient for a satisfactory sexual intercourse. So we have a study in Brazil now that men over 40 years, like almost half of them have some degree of erectile dysfunction, which is like a huge number. So it affects approximately 150 million men worldwide. And although erectile dysfunction does not present risks to the individual's life, it can provoke a series of disorders such as decrease of self-esteem, increase in functionality, social relationship impairment, and depressions, among others. Some studies even refers that the men say that it's vital to their lives to have a good erectile function. So we know that numerous therapeutic strategies exist to improve erectile function, but while these therapies have proven to be safe and effective, they have their limited use prior to sexual practice and do not modify the physiological mechanism of penile erection, like the pills, injections, gels, and other drugs we have available in the market. So the perspective that we want to give you today is to use the electrical stimulation for the smooth muscles and not the skeletal muscles, not to work the strength of pelvic floor muscles that we're gonna see after with pelvic floor muscle exercise, but to improve the quality of the smooth muscles with electricity. So just a quick remind that how it works inside the smooth muscles. So we have the prostaglandin way, but we believe for the new studies that we have that the electricity works on the acetylcholine way. So when the man has the stimulation, so we have the cavernosa nervous terminal that releases acetylcholine that open the calcium channels, and then the acetylcholine get attached to the muscarine receptors and start to release nitric oxide. That is the most important thing that we do want this smooth muscle to produce. So the nitric oxide will enter in a cycle that activates the GMP cyclic, and in the end it will get to the smooth muscle cells relaxations with vasodilatation and erection. So we see that the type 5 phosphodiesterase, it breaks the GMP cyclic, so the men lose erection. So that's why they use tadalafil, sildenafil, because it's inhibitor of the type 5 phosphodiesterases. So saying that, so in different forms of ED, the main change that can occur is in the smooth muscles of the penis, that is the secretion site of nitric oxide. So we can think about diabetes, this means that has bad habits, that don't practice exercise. So studies show that functional electrical stimulation has an endothelial regenerative effect in an animal model with increased release of oxynitric. So we're gonna see that we already have some studies in men's too. So the first paper that we have to to go back history to see from where does it come. So we have Dr. Steve from Hanover, a urologist that did the first study in men's using functional electrostimulation of corpus cavernoso penis for treating erectile dysfunction. So it was not randomized, but what he found was that patients that did not respond for vasodilators start to respond, and that around 33% of the patients regain the full capacity to have their erections. So we have as well this Korean study that's from 2000 that treated in the same way. The protocol was very similar to Dr. Steve, and they saw good results from their research. This research is from the 90s when they start to see in rabbits, they did in mice as well, the effect of the electrofield stimulation in the corpus cavernosus, and they start to see the release of oxynitric and GMP cyclic when they apply electricity. So this study was my master's degree. So we took the study from Dr. Steve from Hanover, and we did a randomized controlled trial with his protocol. And then what we found is with these two questionnaires, the erection hardness score and the EEF5, the International Index of Erectile Function, that they improved it, the improvement was statistically significant. So that's how we use the pads on those men, and then we applied the vocal brief as well, and the quality of life improved. So this journal is the International Journal of Impotence Research, and they did a collection for their 30th anniversary, and they considered that this study that was included on this collection that was like a revolutionary for us to think in another way to treat those men with conservative management, because with pills or injections, they will always have to do it, and we are not looking for recover their problem and just to do it every time that they are trying to have a relationship. So this is unpublished data. So this year we took 30 patients and we did 3 arms. The arm from my master degree, a placebo arm, and the arm that we mixed it, transcutaneous electrostimulation microcurrent. So if you remember microcurrent, we used to heal diabetic wounds, so we mixed these 2 currents, and then we can see on the erection hardness score that they were scoring 1 and 2, and then after treatment, post-treatment, then they improved it a lot with just functional electrostimulation, but with mixed current, they got better results. So in the UCLA, that's unpublished data as well. They will publish, I think, in the end of this year, because it's a well-done research. They are seeing that with those currents that we use on our clinical practice, it induces some proteins and some enzymes. So we are thinking about to work just with skeletal muscles, with nerve stimulation, but we might be done more than that. So what they found was that when we stimulate, we are producing, as we know, VEGF, that's a growth vascular factor, clotho protein, that is a protein knowing to regenerate DNA, SDF, PGF, IDF, there are all growth factors, or leads with immunity, follistatin, that is a muscular protein. So maybe in the next years, we gotta know more from electricity than we do know by now. So this year on AUA, there was this study published that they did the same protocol as I did on my master's degree, but for prostatectomy patients. And they found very good results. So you can see that after 12 months, 52% of the patients that did the electrical stimulation had recovered their erectile function against 19 patients from the control group. So that was a very nice study. So we do know that pelvic floor muscles and erectile function are very attached to each other. So we know that this first layer of muscles that has more to do with the erectile functions from men. So the ischial-cavernosus and bulbocavernosus muscles play the most important role. The ischial-cavernosus muscles stabilizes and maintains the erect penis, whereas contraction of the bulbocavernosus muscles contributes to erections, ejaculation, and the contractions of the orgasm. But all the pelvic floor muscles and sphincters show significant increase in EMG activity during the entire erectile period, increasing the intercavernous pressures through contractions. So we have already a lot of studies about it. So we have some trials like Lavoisier that has a huge number of patients, 230, and he had a positive outcome in treating their erectile dysfunctions with pelvic floor muscle exercise. These two next studies that after 3 months, the group of pelvic floor muscles exercise showed great improvement. So we can see that on the first one, he compared with sildenafil and placebo. So that was a nice study. And the last study is a randomized controlled trial after prostatectomy as well. So showing that after 12 months, the group that did pelvic floor muscles exercise was with more improvement. So to answer this study from the Journal of Sexual Medicine, pelvic floor physiotherapy for erectile dysfunction, fact or fallacy. So for sure, it's a fact. But we do need to do more randomized controlled trials to show efficacy of pelvic floor muscle training and electrical stimulation, probably combine both of them to see the results. And more basic research should be conducted to understand the mechanism of actions of electrical stimulation for erectile functions, because we do know that has some effect, but we not fully understand how does it happen. So we need to keep on with this basic research as well to really understand what does electricity do to those smooth muscles. So I want to invite you all to visit the ICS Institute page. So we have the School of Physiotherapy that we are fulfilling with educational videos. We know that inside ICS TV we have a lot of videos, and so we are choosing the ones that will make more impact for the physiotherapy. So we are splitting it in categories. And what we are seeing that we have lack of content as well. So as we are doing this, we will know what we need to do, what need to be done after. So we have a great working group with Melanie, Paula, Lauren, Julia. And I want to give a big thank to Melanie that is since the beginning with me, and all with her experience, she's making this going forward. So please visit the site, send us emails. You can suggest what should be inside, if you want to send materials from your university, some videos you have recorded that you think that are educational for ICS, just send us, and we're gonna make sure it will go to the school as well. So thank you so much.